What if I told you your arteries might be building dangerous plaque right now, even if you eat healthy and exercise? Stay with me, this could save your life. I was 57, running marathons and teaching preventive medicine. I thought I'd done everything right. But when I finally got scanned, my arteries looked like a 73-year-old's. That diagnosis was a gut punch. I had real risk of a heart attack in the near future. What I learned after changing a few things surprised me. I could reverse arterial plaque. I'll tell you exactly how I did it, step by step, and show the scans that prove it. But first, you need to understand why plaque built up in the first place, and why it might be happening to you. How I found the problem at a conference, a colleague suggested a quick test called CIMT, a 5-minute ultrasound of the neck arteries. No radiation, fast, and it can show soft, unstable plaque years before symptoms. I expected a clean bill of health. Instead, I found 2 plaques and an arterial age of 73. That shocked me. When I dug deeper, I discovered something important: cholesterol isn't the whole story. A bigger driver of plaque is metabolic disease, prediabetes, and diabetes. And metabolic disease is much more common than most people think. I ran an oral glucose tolerance test, the best test to find hidden metabolic problems. You drink a measured glucose drink and your blood sugar gets checked before 1 hour, 2 hours, and sometimes 3. My sugar spiked over 160 milligrams per deciliter. In short, I had enough prediabetes to be building cardiovascular plaque, and I didn't know it. Why a healthy, low-fat diet failed me for years. I ate a low-fat diet, lots of bread, grains, oatmeal, because it was considered heart healthy. But those foods sent my blood sugar up several times a day. That's what damaged my arteries. If your blood sugar goes over about 140 milligrams per deciliter after meals, that's where inflammation starts in the artery wall. One spike won't do too much harm, but repeated spikes day after day set the stage for plaque. Step 1. Test. Don't guess. You can't fix what you don't measure. The standard tests most doctors run often miss the real drivers of heart disease. Start with CIMT, carotid intermedia thickness, detects soft, unstable plaque early. Inflammation markers, C-reactive protein, CRP, and Lp PLA2 show whether plaque is hot and dangerous. Visceral fat measurement, not BMI, but the fat around your organs. DEXA body composition scans measure this and it predicts insulin resistance. If you want, download my free ebook, link on screen, for more details on tests your doctor may not routinely order. Step 2. Cut the right carbs. Once I knew the enemy was blood sugar, my diet plan changed. It wasn't about healthy or unhealthy, it was about what raises your blood sugar after you eat. Problem carbs. High glycemic carbs, breads, rice, pasta, and yes, oatmeal, often spike blood sugar more than sweets do for many people. Safe carbs. Non-starchy vegetables, fiber-based veggies, and small amounts of lower glycemic foods. Practical swap. Swap a bowl of oatmeal or a sandwich for eggs cooked in butter, avocado, salmon, big salads with olive oil, and non-starchy veggies. These keep blood sugar flat and keep you full. Fasting and time-restricted eating help too. Narrowing your eating window, say, 12 hours or even 8 hours, lowers insulin by simply not eating. And if you do get a spike, a short walk or a few calf raises will pull sugar into your muscles quickly, minimizing damage. Step 3. Exercise the right way. I'd done long distance running for years. That built fitness, but it didn't fix my insulin resistance. There's a difference between fitness and metabolic health. Focus on leg muscles. Your legs are the body's largest glucose burners. The more metabolically active your leg muscles, the better your blood sugar control. Use intensity. High-intensity intervals and resistance training matter. Short bursts, 40 to 60 seconds, at 90% effort or REHIT style 20-second all-out efforts 2 or 3 times per session are extremely effective. You can get a big metabolic effect from just a few minutes. Resistance snacks, quick strength moves during the day, wall sits, lunges, calf raises in 3 to 5 minute blocks add up. One longer gym session a week focused on legs plus short home bursts are enough to drive real change. Bottom line, keep some steady cardio if you enjoy it, but add intense leg work and resistance to improve insulin sensitivity. Step 4. Remove hidden roadblocks. Diet and exercise are about 80% of the work. The other 20% matters. Sleep. Poor sleep raises cortisol and makes insulin resistance worse. One bad night can increase insulin resistance for 48 hours. Sleep apnea. I had mild sleep apnea from a narrow dental arch. Fixing my airway, widening the arch with Invisalign, training to sleep on my side, dropped my blood pressure and improved labs. Breathing and stress. Slow breathing activates the vagus nerve and lowers cortisol. Aim for 7 to 10 breaths per minute, inhale 4 to 5 seconds, exhale 6 to 8 seconds for 10 minutes. Devices like Respirate help you learn this pattern. Purpose and stress management. Chronic stress keeps the body in a low-grade inflammatory state. Having a purpose and handling relationship or life stress are real metabolic interventions, not just soft advice. Step 5. Supplements. Strategically, supplements can help, but they don't replace lifestyle. Vitamin D3. I use 5000 IU per day paired with K2, 400 mcg per day. D3 deficiency links to inflammation and higher cardiometabolic risk. K2 helps with calcium metabolism and may support insulin sensitivity. Niacin. It can raise HDL and lower LDL, triglycerides, and Lp(a). It's not a miracle cure, but it can improve important biomarkers. Magnesium. I take magnesium L-threonate for sleep and brain health and magnesium glycinate for muscle and relaxation. Magnesium supports blood pressure and insulin sensitivity. Omega-3, EPA, DHA, strong evidence that these lower cardiovascular risk. Even fish eaters often benefit from a supplement. Aged garlic extract and nattokinase, these have some evidence for plaque stability and clot-related processes. Remember, supplements support a solid diet, exercise, sleep, and stress plan, they don't replace them. Step 6. Use medications when needed. This part makes people uncomfortable, but medications can be powerful tools if used correctly. Low-dose statin. I used a low-dose rosuvastatin not primarily to drop LDL, but to reduce vascular inflammation. Dose and frequency matter. Low, targeted use differs from daily high-dose statin therapy. Blood pressure drugs. ACE inhibitors or ARBs, ramipril or losartan, reduce blood pressure and lower vascular inflammation. Control blood pressure to prevent mechanical damage to arteries. Aspirin or anticoagulants. Once you have confirmed plaque, you move from primary prevention to secondary prevention. Low-dose aspirin may be considered. If you have atrial fibrillation, anticoagulants like Eliquis are more appropriate for stroke prevention. Metformin. Low doses on several days per week can help insulin sensitivity for some people. It's a support, not a substitute for lifestyle. Again, medication is an adjunct. It buys you time while lifestyle changes do the heavy lifting. What the scans showed me, I've been rescanning yearly. Recently I did a CT angiogram with AI plaque analysis. The key thing, soft plaque, the kind that causes heart attacks, was essentially gone. Total plaque still exists, but much of it is stable, calcified, and not going anywhere. My worst narrowing was 17% in the LAD, not alarming, and overall percent atheroma volume was low. My CIMT arterial age stayed much younger than my chronological age. Remember, I carry a diabetes diagnosis, I have the 9p21 genetic risk variant, and I had atrial fibrillation. Still, with this plan I have the arteries of someone a decade younger. That shows lifestyle plus targeted supplements and selective medications can move the needle. Common questions and myths. Myth: if I exercise, I don't need to worry about blood sugar. Fact: you can be fit and still have metabolic disease. Intensity and muscle mass matter. Myth: all carbs are equally bad. Fact: non-starchy, fiber-rich vegetables usually won't spike blood sugar. Glycemic carbs like bread, rice, and pasta are the common culprits for many people. Myth: supplements fix everything. Fact: supplements help, but only on top of diet, exercise, sleep, and stress control. Quick practical checklist to start today. Get tested. Ask for CIMT, CRP, Lp PLA2, a glucose tolerance test, and a DEXA for visceral fat. Cut glycemic carbs and eat more protein, healthy fats, and non-starchy vegetables. Add short, intense leg work and resistance snacks to your day. Improve sleep and screen for sleep apnea if you snore or wake frequently. Consider vitamin D3 plus K2, magnesium, omega-3, and targeted supplements after reviewing labs with your clinician. Use medications only when they fill a clear gap and reduce inflammation or risk. Summary and takeaway: you can't rely on old rules like low fat is always best, hidden metabolic disease, repeated blood sugar spikes, and insulin resistance often drives plaque more than simple cholesterol numbers. Test what matters, cut the right carbs, build metabolically active leg muscle with high intensity work, fix sleep and stress, use supplements wisely, and consider targeted medication when needed. That combination is what reversed my plaque and can protect you from heart attack or stroke. Memorable takeaway: stop guessing, measure what matters, and then fix it.
Thanks for watching Vitality Healthworks. Small, science-backed habits build lasting health. Start today. If this helped, like and subscribe and turn on notifications. See you in the next video.